Hello viewers, welcome back. This is Subhadra Rosan from class 8D, and today we are going to discuss about first aid and what are some basic principles that has to be kept in mind before doing a first aid to anyone. So what is a first aid first of all? First aid is the aid or the immediate assistance that has been given to a person before a professional medical attention is provided, like in case of minor burns, snake bites, stings, or anything else. So, when we call a doctor, it will obviously take some time for him to reach our home and take us to the hospital. So, in that time, what can be done so that the person get relieves from the pain? So, that is called first aid. Now, we'll see what are some basic principles that has to be kept in mind before doing a first aid. So, before a first aid is done, we should call a physician or an ambulance immediately. Second is keep the environment tranquil and calm. Third is give the responsibility of first aid to a trained person so that he does it properly. Fourth is examine the victim carefully and see what's the need that is required just now. What's the immediate help required in his body? Fifth is never make an unconscious person drink fluids. Do you know why? Because the nasal passage that goes from the mouth to the nose is open when a person is unconscious. So, whenever a person will drink fluids at the time of unconsciousness or after just recovering, the liquid will go inside the respiratory system, and in that case, the person may die even. The sixth principle is do not move the victim if it is required. So, before the doctor arrives, let the victim be laid on the bed calmly. The last but not the least, the principle is that we should protect the victim from getting further injury. That's very important, or else it will be very serious again. So, that was something new about first aid. Hope you liked it.
Good evening everyone, this is Ashwika from 8th and today I am going to discuss about bleeding. So what is bleeding? The release of blood from broken blood vessels which is either from outside or inside of our body is known as bleeding. Now I am going to say some actions to prevent from bleeding. First, apply some pressure on the wounded part and keep on maintaining pressure by a thick bandage or a clean a piece of cotton. For example, I have got a cut on my finger, so now I'm going to apply some pressure on the wounded part like this, so that it will help from to stop from bleeding. Now raise your injured arm, which must be above the level of the heart if possible. You have to raise your this limb. If anywhere you got injured, you have to raise that limb and in level of your heart. If blood doesn't stop flowing, make sure that your victim must lay down on a firmly flat surface to prevent from bleeding. You can also wash your infected part on by water, and you have then dry it with a clean cotton cloth. You can also rub ice because it is the best way to clot the blood. Then after you have to apply some mild antiseptic cream. We are using mild antiseptic cream because it soothes and heals the infected part, which protect against infections. It can also reduce the risk of infections against minor injury. If it's flowing continuously, make sure that you must rush towards the doctor immediately so the doctor would recover your wounded part and heal you soon. So here I conclude my explanation. Hope you all understand it. Thank you so much.
Good morning everyone, I'm Anvasha Hatpati from class 8, section S, and I'm going to present my topic on bleeding. So let's start with what is bleeding. It is the loss of blood from the blood vessels which can range from mild to severe depending on the size of wound. Bleeding is classified under two broad headings, that is depending on site and depending on blood vessels involved. Depending on site, it is of two types, external and internal. Depending on blood vessels involved, it is of three types, arterial, venous and capillary bleed. Now let us talk about each one in detail. In external bleeding, the blood comes out of the skin, which in internal bleeding, the blood remains confined inside the organ. In arterial bleed, the blood is bright red in color and comes out as pearls. In venous bleed, the blood is dark red in color and flows continuously. Capillary bleed is loss of least severe one and the blood flows out very slowly. Let us see what are some common bleeds we face in our day-to-day life. Some common bleeding that we face in our daily life are nosebleed, that is epistaxis, gum bleed, puncture, abrasions, and laceration. When someone is bleeding, he may show some typical symptoms such as fainting, giddiness, cold skin, weak pulse, heavy sweating, etc. Finally, in bleeding, our main focus should be on first aid that should be given to the person who is bleeding. There are some do's and don'ts. Let us see them one by one. Do's: direct pressure, elevation of part, washing with clean water or any antiseptic solution, application of betadine or a band-aid. Get medical help if bleeding still continues. Don'ts: peek at a wound to see if bleeding has stopped. Probe a wound. Remove dressing if it gets soaked with blood. Try to clean large wounds. Thank you.
Hello to everyone, myself Harshita Das from Deepal School, Barampur, and today I will say about the first aid to be followed for a person who is been bitten by an animal. First, immediately wash the wound with soap and running water, as washing the wound with soap and running water is very effective way of reducing the risk of some dangerous diseases that is caused by an animal bite. Then the next step is to take the victim to a doctor. Then the third measure to be followed is to find the animal who has bitten the person and take the animal to a veterinarian so that he can check whether the animal is suffering from rabies or not. Now let's learn about the most dangerous disease that's transmitted by the animals, that is rabies. What is the symptoms of it and what is the treatment for it? So, what's rabies? It is a deadly virus spread to the people from the saliva of infected animals. What are the symptoms of rabies? Pain, fatigue, vomiting, headaches, fever. How to prevent rabies and what is the treatment for it? Rabies is both prevented and treated with rabies vaccine. The rabies vaccine is made from killed rabies virus. The vaccine cannot cause rabies. A special immune globulin can also be helpful. What if we don't treat rabies? Rabies is almost always fatal if it is left untreated. In fact, once someone with rabies starts experiencing the symptoms, they usually do not survive. This is why it is important to seek medical attention right after an animal bite, especially if the bite is from a wild animal. I hope that I made this portion clear for all. Thank you and have a nice day.
Snake bites. Snakes most often bite in the hands, legs, arms, or foot. Snake bites are especially common in the poor communities, often in the rural areas. People with specific jobs are also at risk, including the hunters, the fishermen, the herders, the agricultural workers. Now, what if anyone is bitten by a snake? At first, remove all the jewelries or watches, as this could cut into the skin if swelling occurs. Wash the bitten area by strong potassium permanganate solution and tie a tight bandage just above the wound to prevent the spread of the venom into the bloodstream. Give a hot drink to the victim and try to keep the victim warm. Take the victim immediately to the hospital. So these are some precautionary measures. I hope you will follow it. Thank you.
Hello everyone, I am Saina Dutta from class 8S going to discuss about the topic snake bites.
So, here I got the topic about snake bites. We have heard the word snake bites in our surroundings, but what does it actually mean? A snake bite is a common injury caused by the bite of a snake, especially a venomous snake. A common sign of a bite by a venomous snake is the presence of two puncture wounds from the animal fangs. So here we can also say that the injury which is caused by the bite of the snake is known as snake bite. It can lead to injuries. If in major cases, then it can lead to death. So here, as we can see in the picture, here is the two puncture wounds, which can denote that the snake has bitten here. So here we can see the two puncture wounds. Then snakes most often bites on the leg, on the foot, hand or arm. A bite from venomous snake is very dangerous. So here also we can see the examples of the bite of the snake bites. So next, here what are the complications of snake bites? Now we will learn about the complications of snake bites. Bleeding, kidney failure, severe allergic reaction, headache, dizziness, vision damage, chronic ulceration. So these are some complications of snake bites. So what do we mean by chronic ulceration? Here it means that the areas on the legs, ankles or feet which has caused the great skin loss, leaving a raw wound which take times to heal. Here we mean this is the meaning of chronic ulceration. Next, we will learn about the symptoms of snake bites. What are symptoms of snake bites? Fast heart rate, nausea, sweating and bruising. These are the four symptoms of snake bites. Now, what are the precautions? What are the precautions to be taken? See, cover the wound with loose sterile bandage. Remove shoes if the leg or where the leg or foot was bitten. Immediately move from the area where it occurred. Note, before applying bandage, we have to wash the bitten area with strong potassium permanganate solution. So, here it says that before covering the wound with loose sterile bandage, we have to wash the bitten area with strong potassium permanganate solution. Then we will cover the wound with loose sterile bandage. Then next, here is the first snake bite kit, alcohol preparation pad and elastic strip and many more here things are there. Thank you for this opportunity.
Hi everyone, I'm Sudhanjali Misra of class 8D from DePaul School, and today I'm going to explain about snakes bite. So, snakes often found in the rural areas and forests where a lot of trees are present. Snake often bite on the hand, arm, foot or legs. So, snake bite may be of non-venomous and venomous. Whereas a non-venomous snake bite that is made by the snake that is incapable of secreting the venom. It can cause little pain and swelling around the bitten area. The victim of the non-venomous snake bite can experience the psychological reaction and may be faint. Whereas in the venomous snake bite can be fatal and require an immediate medical reaction. The symptoms of a venomous snake bite, you will find the presence of the two puncture wound from the animal fangs. Then we will go to the first aid. From the first aid, first thing you need is to do that wash the bitten area with the potassium permanent solution and tie a tight bandage just above the wound to prevent the spreading of the venom to the bloodstream. If the poisonous things will reach the bloodstream, then it can cause heart attack and several health problems. After that, give a hot drink water to the victim and keep him warm. So after that, take the patient to the doctor immediately. Thank you.
Good morning everyone, myself Sanjana Surya of class 8th. I am here to present some few lines on the topic snake bite. Snake bite is an injury caused by the bite of a snake, especially venomous snake. Now, what is venomous snake? Venomous snake means poisonous snake or the snake which contains poison. The most common sign of the bite of a venomous or poisonous snake is the presence of two puncture wounds from the snake's fangs. This may result in redness, swelling and severe pain at the area of the wound. For see tips in case of snake bite, what we should do and what we should not do. First of all, let us discuss what we should do. We should call immediate medical help. We should clean the wound with potassium permanganate solution and apply a pressure bandage. We should restrict movement and be in full rest. We should transport to the nearest hospital that can provide emergency care. We should remove anything tight from around the wound, for example, rings, anklets, bracelets, etc., because it can be harmful in case of swelling occurs. Now let us know what we should not do. We should not try to suck out venom. We should not elevate the wound above the heart or chest level. We should not use aspirins, take pain relievers, or use some home remedies or traditional remedies because it can be very harmful. We should not apply ice on or around the wound because it can be dangerous. We should not try to cut the wound with the help of knife or scissor because it can be very dangerous to the wound or to the victim. So thank you.
My name is Srimarath from class 8S. Today I am going to explain about stings of the insects. What do you understand by the term sting? Sting is a part of an insect body. They are very much sharp. They are even sharper than the nib of a needle. What if an insect stings a person? The venom of the bee sting contains proteins which affects the skin cells and the immune system of the body, resulting pain and swelling around the region of the sting. Venom. What is venom? Venom is the poisonous liquid of the bee sting which contains proteins. It affects our skin cells and our immune system of the body, and as a result it causes pain and swelling around the region of the sting. Pain and swelling. First, when bees sting, they release a chemical called melittin into their victim. This venom immediately triggers pain receptors, causing a burning sensation. Second, because a bee stinger is in fact barbed like a jagged sword, when it penetrates the victim's skin, it actually dislodges from the bee, remaining there. How to treat a bee or a wasp sting? Here are some steps which can help us to treat bee or wasp sting. Remove the stinger. Step 1. Scrape the sting site with a fingernail or use tweezers to remove the stinger. Step 2. Wash the area with antiseptic soap and water. Step 3. Pat dry and apply some antiseptic ointment. Apply ice. Step 1. Put some ice cubes in a thin washcloth and tie it. Hold this pack on the affected area for 10 to 15 minutes. Step 3. Reapply every few hours until the pain and swelling are gone. Here are some more steps to treat bee or wasp stings. Thank you for giving me this opportunity.
Users, this is Subhadra Rosan from class 8D, and I'm going to explain on the topic of stings and what is the immediate first aid one should prefer after being stung by an insect. So, how a sting is occurred? First of all, a sting is occurred when an insect injects its poisonous venom from its stingers to our body. It is very common in our day-to-day life. It's not fatal, but it hurts a lot. So after being stung by the insect, let's see for the first aid one should prefer. The first and foremost easier remedy I would advise is to apply ice or pour cold water on the affected area, because the cold reduces the itch and inflammation and soothes the pain. The next remedy I would suggest is to apply aloe vera gel. Yeah, aloe vera gel. It's a natural remedy for soothing the skin, also for moisturizing. Many people use it. Besides soothing, the plant holds many antibacterial and anti-inflammatory properties. The next remedy I would suggest is to apply raw honey on the wounded area. It contains many antibacterial elements which reduces the inflammation when applied. But remember to carry on this remedy indoors, or else the bees get attracted again by the smell of the honey. The next remedy I would prefer is the papaya. Yeah, the sweet and juicy ones. We don't know, but it's true that it contains many enzymes that are really essential for us. And for stings, it has certain enzymes that reduces inflammation. By doing so, it helps us compete with the venom. So after the wounds are getting healed, the next remedy to remove the scars on the wounds is sugar. Yeah, sugar is one of the best remedy to remove the scars from the skin. Some people also apply baking soda solution in the case of bee sting. Do you know why? I'll say you. The baking soda is basic in nature, while the venom of the bee is acidic in nature. So, when an acid and base reacts, it cancels the effect of each other. This process is called neutralization. So, the same process occurs here. They cancel the effects of each other, so we get relief from the pain. But this is not the case with the wasp. The venom of the wasp is basic. Also, the baking soda solution is basic. So, it won't do one. We have to look anything else. Yeah, vinegar. It's a nice idea. It's acidic in nature. So for the venom of a wasp, we can use vinegar. It will reduce the pain and it will give us relief. So next time you get a sting, try one of these methods.
Hello, good morning everybody. This is Tanushree Panda of 8th going to explain you about stings. What does stinging means? If an insect, plant or animal stings, it produces a small but painful injury, usually with the poison by brushing against the skin or making a very small hole in the skin. This means when a stinging insect, plant, animal stings, it produces a painful injury causing that area red, but it is very small injury, or it also makes a very small hole which cannot be seen bare eyes in the skin. So here you can see this is how the bees sting the skin, and that part becomes red. Next we are going to be learning about what are stings. A small sharp pointed organ at the end of the abdomen of bees, wasps, ants and scorpions, capable of inflicting a painful or dangerous wound by injecting poison. So stings are an organ of stinging insects. It is small pointed organ present at the end of the abdomen of insects like bees, wasps and scorpions that is capable of doing a painful or dangerous injury by injecting venom or poison. As you can see here, this is the stinger, and above it there is a venom sac where contains lots of venoms that inject into our skin while stinging. Next, what are insects that sting us? There are so many types of insects that sting us, but some of them are wasp, honeybee, scorpions, fire ants, yellow jacket, hornet. This is honeybee, this is wasp, yellow jacket, fire ants and hornet. Next, the reasons why insects sting us. There are so many reasons, but some of them are: insects will sting humans only to defend against a perceived threat. This means insects will only try to sting us when they think they are unsafe from us or to defend against the perceived threat. Next, what to do after a bee sting? There are 3 simple steps to follow after a bee stings us. Okay, the first thing is remove the stinger with a blunt edged object, then apply a cold compress. Then after some time, evaluate the area for a few hours. Few minutes or few hours, you can evaluate according to your convenience. Next, some interesting facts about stings. The most painful sting of all is the bullet ant sting. The average adult could withstand more than 1000 stings, whereas 500 stings could kill a child. Velvet ants have the longest sting compared to their body size out of any bee, wasp or ant species. It is correct that female worker bees will die if they sting you. Male honeybees, drones can't sting, while queen honeybees can sting repeatedly. Thank you.
Hi, I'm Abhijit of class 8D. Today I'm here to tell about the first aid that should be given to a person who has got burns. First of all, what is a burn? A burn is nothing but the damage to the skin or deeper tissues due to any hot material such as fire or concentrated acids. Suppose by mistake you spilled hot coffee on your hand and it has got a burn. Then in this case, what should you do? First of all, you should wash the affected area with cool water or running water immediately for a few minutes. Warning: don't use ice or very cold water because doing so will damage the tissues further. And one more thing, Don't use any greasy substance like butter because this will worsen the situation since applying it will reduce the process of heat loss from the skin due to the burn. And once the pain is relieved from the burnt area or the pain subsides, then you should wrap the affected area with a dry and clean bandage because doing so will reduce the chances of infection in the skin due to bacteria or fungus. Next, the victim is laid on the bed and is given mildly salted fluid or ORS or RL solution for every 15 minutes for an hour. This is done because salt fluids will reduce the loss of plasma from blood due to the burn, and it will also help in maintaining the water and salt balance in the body. RL solution is given to the victim because RL solution's composition and osmolality is closely corresponding to the bodily fluids that are lost from the body due to the burn. In case of major burns, the victim should be immediately taken to hospital and be given medical assistance. These all things should be done if a person gets burned. With this, I conclude my topic. Thank you.
A fracture is the breaking of bones due to a fall or an accident. The bones of an overweight person gets cracked easily. When the bones shift from joints is known as dislocation of bones. In case of fracture of bones, lie the person on the bed, loosen their clothes without moving the injured part, tie a sling with a wooden scale under the injured part, and take the patient immediately to the doctor.
Hi friends, I'm Avinav Sakti Swarup of class 8D and today I'm going to explain you what are the first aids you can do when a person has consumed a poisonous substance. If a person has consumed a poisonous substance like mercury or arsenic, you can give him milk or water to drink and make him try to vomit. To make him try to vomit, you can just give him a plenty of salt water or just put your finger down his throat. After vomiting also, if the poisonous substance doesn't come out, then you must take the victim or the person who has consumed the poisonous substance to a doctor immediately. I hope that you have understood the poisoning part. Thank you.
Hello everyone present here. I am Jyotirmay Chaudhary of class 8S, roll number 35. And today I am going to speak today's topic, first aid on poisoning. How to help a person who has been poisoned. Let us learn first what is first aid. First aid is the immediate aid or medical assistance to a person who is sick, injured, or when suddenly its health deteriorates. While giving first aid, it's important to call an ambulance, medical practitioner, or any other medical help as soon as possible. So we can learn that we should always try to give first aid to a person immediately when he is sick or injured. But we should also call the ambulance, medical practitioner, or doctor's help as soon as possible to save the life of a person. Now let us learn about poisoning. What is poisoning and how does it affect us? So we know that poisons are chemical substances that are highly toxic and poisonous in nature, and it contains many chemicals which can be fatal. When a person is poisoned, its brain and nervous activity is halted, coma, unconsciousness, etc. So the poison gets into the blood, causing blood poisoning. It also gets carried away with the blood to other organs, making the organ's normal activity halted. If no help is provided, the basic body functions of a body are declined. It may even cause partial or complete organ failure. And if no help is provided immediately, the person may even pass away. Therefore, it's necessary to provide medical assistance to a person who has been poisoned. Now let us learn about the symptoms when a person is poisoned. Burns or redness around the mouth and lips, breath that smells like chemicals like gasoline, paint thinner or wax, vomiting, difficulty breathing, drowsiness, confusion or other mental status. In case a person consumes poison, try to make sure the person is conscious. Now try to induce vomiting or make the person vomit. It can make most of the poison spill out of the throat before it enters into the bloodstream. Give the person some milk, water, or salt water to induce vomiting. If the person is unable to breathe properly, or if its health is deteriorating, immediately shift the person to a room with open air. Also, in case of breathing difficulty, try giving the person cardiopulmonary resuscitation or CPR. It's a process where we can breathe air into a person's and do compressions in its chest to enable breathing again. Important. Even if person is provided immediate first aid assistance, there shouldn't be any delay while informing poison control authority, especially ambulance or doctor and other medical assistance. Thank you.
Hello friends, today I am going to say about unconsciousness. What is unconsciousness? Unconsciousness is a type of physical activity of a body when there is a very small amount of supply of blood to the brain and the blood pressure which we are seeing as PP, it falls down suddenly, by which our brain stops responding. If we see a person means unconscious or fainted, lay him down comfortably and loosen his clothes, by which the blood regulates properly. And we have to see that is there any type of like factories or and all, because impure air isn't good for a unconscious body. If very small amount of oxygen will go in the body, there will be a very less supply of blood in the body. If there will be a very less supply of body, there may be a chances of death of a human. So see a place where air is clean and it is pure. When any person is being conscious again, please, we all should encourage him to means stand up properly and the person to rest for a while, because if he will suddenly stand up or suddenly he will do any action, then there may be a chances of being high blood pressure, and again he can be.
Morning to one and all watching this video. I'm Arpita Swai from DePaul School of Standard 8S, present to you about the topic first aid for unconsciousness. Let's get started about the topic unconsciousness. What is unconsciousness? How it occurs? Unconsciousness is when a person is unable to respond to people's and activities. It means that when a person falls unconscious, he or she is unable to respond to people or activities which are done around them. The person feels dizziness and falls unconscious in the floor or the place. It means that the person feels dizziness and fall unconscious where he or she is standing. Unconsciousness occurs as a result of a sudden brief drop in blood supply to the brain. It means unconsciousness occurs as a sudden serious fall of blood supply to the brain. Next point. It may cause due to the heavy use of drugs or alcohol. It means unconsciousness also may occur due to heavy use of drugs or alcohol. So now, first aid for unconsciousness. First point, the person who faints, lay him down comfortably. It means that the person who falls unconscious, lay him down comfortably somewhere. Check the person's breathing airway and pulse repeatedly. It means repeatedly check the person's breathing, oxygen level and pulse. Loose the person's clothing and make sure that there is a sufficient amount of air in the surrounding of the fainted person. It means that loosen out the clothing the person is wearing and make sure that there is cool and enough air across the surrounding of the fainted person to gain consciousness faster. Explain point 4. So, when the person gains unconsciousness, encourage the person to take rest for few hours before moving. It means when the person is out of unconsciousness, make him rest for few time before moving. watching my video on unconsciousness. I hope you got some first aid tips on unconsciousness. Thank you.
Hi, I am Arishmita Swain from class 8 and here to say you about foreign bodies in the eye. What are foreign bodies in the eye? Foreign bodies are the substances that are unsuitable for an eye and which when enters the eye may affect it. So what are the measures that need to be taken to take out that foreign body? First of all, pull the lower lid of your eye, I mean this part, and observe carefully where the foreign body is present. After that, take a moistured curtain, I mean the curtain which is slightly wet, and try to take out that foreign body from your eye with the help of this curtain by slightly touching it. It would be more easier if you tie the same curtain in a stick and use it. You will find it more easy to take out that foreign body from your eye. So finally, put some lotion in your eye and if possible apply boric acid. After following this many steps also, if you feel that the foreign body is still in your eye, then consult a physician. And this was all about foreign bodies in the eye. Thank you.